Hello, health advocates. Today we're going to tackle a topic of vital importance: the health of our kidneys. These small organs play a crucial role in maintaining the balance of our body by filtering blood, removing toxins, and regulating blood pressure. However, unlike other organs like the liver, the kidneys have a limited capacity for self-repair. Therefore, understanding how they function and how the foods we consume affect them is essential for preserving them and ensuring they continue to function well for many years. The importance of the kidneys and the prevalence of chronic kidney disease. The kidneys are the body's natural filters. Every day, they process about 120 to 150 liters of blood to produce approximately 1 to 2 liters of urine, which is composed of waste and excess fluids. This process not only removes toxins from our bodies, but also helps maintain a healthy balance of water, salts, and minerals. However, when something goes wrong and the kidneys begin to fail, the consequences can be severe. Chronic kidney disease, CKD, is one of the most prevalent conditions worldwide. In the United States, for example, about 37 million people, or 1 in every 7 Americans, suffer from CKD. This condition occurs when kidney function is compromised for a period of 3 months or more, and it can progress silently to advanced stages where symptoms become more evident and treatment more complex. One way to measure kidney function is through the glomerular filtration rate, eGFR, which indicates how much blood the kidneys can filter per minute. When this rate falls below 60 milliliters per minute, doctors start to be concerned, as it indicates a significant decrease in the kidney's ability to perform their functions. Major causes of kidney damage. But what causes chronic kidney disease? There are several reasons, but some of the most common include type 2 diabetes, high blood pressure, kidney infections, and prolonged use of certain medications. Type 2 diabetes and insulin resistance are the main culprits behind many cases of CKD. When blood sugar levels remain high for long periods, it can damage the kidney's small blood vessels, known as microtubules. This type of damage is similar to what occurs in the eyes of people with diabetes, where excess sugar causes swelling and injury to the delicate blood vessels, resulting in complications such as diabetic retinopathy. High blood pressure is also a crucial factor to consider. Elevated blood pressure puts extra strain on blood vessels throughout the body, including the kidneys. Over time, this pressure can cause significant damage, impairing the kidney's ability to filter blood properly. Therefore, controlling blood pressure is vital for preventing kidney disease. Another common cause of kidney damage is glomerulonephritis, an inflammation of the kidney's small filters, glomeruli. This condition can be caused by infections, autoimmune diseases, or other conditions affecting the immune system. Additionally, prolonged use of certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and some antibiotics, can cause kidney injury, especially if used in high doses or for long periods. The different stages of kidney disease. Chronic kidney disease is divided into 5 stages, each reflecting the degree of kidney function impairment. Stage 1, the glomerular filtration rate, eGFR, is above 90, which is considered normal. At this stage, kidney disease may not present symptoms, and changes in kidney function are minimal. However, the presence of proteins in the urine may indicate that something is wrong. Stage 2, the eGFR drops to between 60 and 89, which is still within the normal range but with initial signs of kidney damage. Even though symptoms may not be evident, it is crucial to adopt preventive measures to avoid the progression of the disease. Stage 3. The eGFR ranges between 30 and 59. This stage is divided into 3A and 3B, depending on the severity of kidney function reduction. Symptoms may begin to appear, including fatigue, swelling, and changes in urinary frequency. At this point, the need for medical intervention becomes more evident. Stage 4. The eGFR drops further to between 15 and 29. At this point, kidney function is severely compromised, and symptoms become more pronounced. Strict dietary changes and intensive medical treatments are necessary to slow the progression to the final stage. Stage 5. The eGFR is below 15, indicating end-stage renal disease. At this stage, the kidneys can no longer perform their vital functions, and treatment options are limited to dialysis or kidney transplantation. Dialysis can prolong life but comes with a significant impact on quality of life. Kidney transplantation, on the other hand, offers a chance for long-term survival, but not all patients are eligible, and organ availability is limited. Why limit certain foods in cases of kidney disease? One of the primary concerns that arise when discussing kidney disease is diet. When the kidneys are damaged, they lose the ability to effectively filter substances such as sodium, potassium, phosphorus, nitrogen derived from proteins, and even fluids like water. While these substances are essential in a healthy body, in damaged kidneys, they can accumulate and cause further harm. In the early stages of kidney disease, stages 1 and 2, there is usually no need for severe dietary restrictions. The focus should be on a balanced, nutrient-rich diet, emphasizing whole foods that help maintain overall body health. Foods high in antioxidants, such as fruits and vegetables, can be particularly beneficial as they help combat inflammation and oxidative stress, which are contributing factors to kidney damage. As the disease progresses to stages 3 and 4, it becomes important to consider limiting certain nutrients. Sodium, phosphorus, and protein are at the top of the list of restrictions. Sodium, which is abundant in processed foods, can cause fluid retention and increase blood pressure, worsening kidney damage. Phosphorus, found in many foods, including meats, dairy, and whole grains, can build up in the blood when the kidneys are unable to eliminate it properly, leading to bone and cardiovascular complications. Protein, on the other hand, is a double-edged sword. While it is necessary for muscle maintenance and other bodily functions, its metabolism produces byproducts like urea, which the kidneys need to eliminate. In a healthy kidney, this is not a problem, but in a compromised kidney, the accumulation of urea can cause symptoms such as nausea, fatigue, and loss of appetite. Therefore, in the advanced stages of kidney disease, it is crucial to find a balance between sufficient protein intake to maintain health and limiting it to avoid overburdening the kidneys. In stage 5, kidney function is so compromised that an extremely strict diet is required. Sodium, potassium, and phosphorus must be closely monitored, and even water intake may need to be controlled. For patients on dialysis, dietary control is even more crucial, as the treatment does not fully replace kidney function and can lead to the accumulation of waste and fluids between sessions. Lifestyle and kidney health. In addition to dietary modifications, maintaining a healthy lifestyle is fundamental for kidney health. Regular physical exercise helps control blood pressure, improves insulin sensitivity, and promotes cardiovascular health, all factors that contribute to kidney protection. Moreover, stress reduction is essential, as chronic stress can raise blood pressure and trigger inflammatory responses in the body, further impairing kidney function. Practices like meditation, yoga, and other relaxation techniques can be beneficial for keeping stress under control. Getting enough sleep and maintaining proper hydration are also important aspects of kidney care. While fluid intake needs to be monitored in the advanced stages of CKD, it is essential to avoid dehydration, which can put additional strain on the kidneys. References and scientific recommendations. Research on chronic kidney disease, CKD, and the influence of diet and lifestyle is extensive and continues to evolve. Studies show that adopting a plant-based diet can be particularly beneficial for people with CKD, as it is naturally lower in phosphorus and protein compared to a diet rich in animal products. Additionally, plant foods are high in antioxidants and anti-inflammatory compounds, which can help protect the kidneys from further damage. A study published in the Journal of Renal Nutrition highlighted that diets rich in fruits, vegetables, whole grains, and legumes are associated with a lower rate of CKD progression. These foods provide a wide range of essential nutrients, such as fiber, vitamins, and minerals, that support overall health without overburdening the kidneys. Another important point is the control of protein intake. Research suggests that a diet with moderate protein intake, primarily from plant sources, can help reduce the strain on the kidneys. A study in the Clinical Journal of the American Society of Nephrology indicated that replacing animal proteins with plant proteins may reduce albumin excretion, a protein that can be present in urine at elevated levels in people with CKD, which is a sign of impaired kidney function. Foods to avoid and beneficial foods. For those dealing with chronic kidney disease, knowing which foods to avoid and which to include in the diet is crucial. Here are some recommendations based on research. Foods to avoid. High-sodium foods. Avoid processed foods, fast food, and canned products that contain high levels of sodium. Read labels and choose low-sodium versions whenever possible. Processed meats. Deli meats, bacon, and sausages are high in sodium and phosphorus, which can overburden the kidneys. Additionally, processed meats are associated with a higher risk of chronic diseases, including CKD. Full-fat dairy products. Cheese, whole milk, and yogurt contain high levels of phosphorus and can contribute to the buildup of this mineral in the blood. High potassium foods. While potassium is essential for muscle and nerve function, in advanced stages of CKD, the body may not be able to eliminate it properly. Limit intake of foods like bananas, oranges, potatoes, and spinach. Beneficial foods. Low potassium fruits. Apples, grapes, and berries such as strawberries and blueberries are great choices for those needing to control potassium intake. They are rich in antioxidants and help combat oxidative stress. Low phosphorus vegetables. Cauliflower, bell peppers, and onions are options that can be included in the diet without overburdening the kidneys. They also provide fiber and other essential nutrients. Whole grains. While phosphorus intake needs to be moderated, opting for whole grains over refined ones, such as brown rice instead of white rice, can offer more fiber and nutrients, as well as help with satiety. Olive oil. Rich in antioxidants and healthy fats, olive oil is an excellent choice for cooking and seasoning foods, promoting cardiovascular and kidney health. The role of hydration. Proper hydration is essential for maintaining kidney health. Drinking enough water helps ensure that the kidneys can perform their filtration functions efficiently. However, for those in advanced stages of kidney disease, fluid intake may need to be closely monitored to avoid fluid overload, which can lead to swelling, hypertension, and strain on the heart. The general recommendation for people with normal kidney function is to consume about 8 cups of water per day, but this can vary depending on climate, activity level, and other health conditions. For CKD patients, it is essential to follow the guidance of a doctor or dietitian regarding the optimal amount of fluids to consume. Caring for your kidneys is an ongoing task that requires attention to diet, lifestyle, and overall health. Understanding the factors that affect kidney health and making informed dietary choices can help prevent or slow the progression of chronic kidney disease, improving quality of life. If you or someone you know is dealing with kidney issues, remember that small changes in diet and lifestyle can make a big difference. Adopting a proactive approach to kidney health, focusing on a balanced diet, regular exercise, and stress management, is the best way to protect these vital organs. If you enjoyed this content and want to learn more about how to keep your kidneys healthy, along with other valuable health tips, don't forget to subscribe to the Purely Health Tips channel. There, you'll find a series of videos dedicated to promoting a healthy lifestyle and preventing disease. Click the subscribe button and turn on notifications so you don't miss any of our upcoming videos. Let's journey together toward a healthier and more balanced life.